For the next disease condition which we'll be looking at, if it occurs in pregnancy, what will be the complication? This is congenital syphilis. So if a mother has syphilis, then she happens to push this disease to the baby, maybe during pregnancy, through the placenta, during childbirth. What will be the effect on the baby? Do you understand? So it usually occurs with Treponema pallidum. That's the bacteria that causes syphilis. So if a pregnant person transmits it to their baby during the pregnancy, which I said is through the placenta, or during childbirth, as the baby is navigating the birth canal, all right, there is a lot of wounds coming up and there's mixture of fluids, right? There could be complications coming up. So what's the risk on the baby? If it occurs early on in pregnancy, there's a risk of you having a miscarriage. There's a risk of you giving birth to a baby and the baby is already dead. The baby's growth is restricted too. If it occurs late in pregnancy, that's like the third trimester, when you are going towards delivery, okay, it can still make you deliver this baby before the due date. Okay, you deliver this baby and has a low birth weight. There's neonatal death at birth. So the baby has bone deformities. Can you see this? Bone deformities. All right. Can you see the teeth? Deformities. All right. Can you see the skull bones? Deformities. Okay. So there's anemia. All right. So the baby's, the blood is not really cool. The liver is enlarged. The spleen is enlarged. They're having rashes all over their body and all of that. Do you understand? So untreated syphilis can lead to blindness, can lead to deafness, can lead to intellectual disability, can lead to skeletal abnormalities. You can see this guy's leg is not cool. All right. So diagnosis, you just want to spot out, the bacteria. Okay. Blood test, physical examination. You check out for the cerebrospinal fluid. This is because you are checking to see if the syphilis is now going to the central nervous system, which causes neurosyphilis. Then X-rays, you are trying to access the level at which these bones are damaged and can they be repaired and all of that. Treatment is penicillin. That's the gold standard. Okay. So in pregnant individuals, intramuscular benzathine penicillin G. In newborns, intravenous or intramuscular penicillins for 10 days. Okay. So it's something that can be easily handled, but if it is not handled properly, if it is ignored, all right, it comes to all these complications.